We move on to the question and answer. Dr. Clement, please.
Thank you very much. Good afternoon. And thank you for the great presentations and very interesting session. I have one question to the last presentation, if I may. And this is referring to you highlighting the importance of eutrophication across large areas in Asia, which is very similar to the concerns that we see in Europe since decades, actually. And the action in order to improve has been rather slow, especially because of agricultural sector lagging behind with reduction of emissions, and also because experience in understanding mitigation opportunities and costs associated with it, as well as spreading technology that would enable us to reduce emissions of ammonia, especially from agriculture, has been progressing, but obviously the application has been rather slow. I would like to ask if, in view of these results, this is a very recent paper, I understand. I would have to look really into this because I see this is 2022 paper. If there is any communication to the policy community and any action taken in Japan, for example, or Korea, or China to address the question like eutrophication, because there was so much pressure on health, and we've heard in the previous presentations, of course, and there's a lot of interest globally and regionally on health issues, but eutrophication and ecosystem have been a little bit behind in that respect. Thank you.
Thank you for your comments and suggestion. The question. Actually, the nitrogen deposition and the nitrogen cycle is were very much concerned by the scientists, and also recently. We have been discussing the importance of this issue with some policymakers, but actually, in the EANET or in the within Japan national levels, there at the moment we have just shared this information with the government officers. This kind of the assessment has been progressed or something like this, but still we don't have any clear policy relevant discussions among us. But actually, as a scientific community, many of the scientists on the nitrogen cycles, international nitrogen conference or some other communities which are participated by the many various scientists, including the agricultural scientists or some social scientists. Actually, they are very actively discussing this issue. We know that. So we need to discuss how air pollution issue is related to this large nitrogen cycle, or how we can contribute to the whole nitrogen cycle management or something like this. Thank you.
Thank you.
Any other?
I'm sorry, I have another question.
Yes.
But this is in case no one else has questions. I don't want to grab the floor for all my curiosity, but in case there's no other questions, I have one other question.
Yes, please.
Thank you. So my question is related to one of the earlier talks from Professor Ueda about the health impacts from particulate matter and the studies that she's been doing. I wanted to ask specifically about she highlighted the mobility aspects and the importance of that. And this is, of course, something that is triggering and can trigger a lot of action, because this is observed on more immediate more immediate terms, a lot of this. But the data situation has been rather poor in large parts of the world, actually. So I wonder, and also harmonization of that information that would support collection of data to support estimates of mobility and costs associated with mobility. I wonder if there is some unified action to improve that, for example, across Asia and South Asia, for example, where the pollution levels remain very low and the action is a little bit slower than in Northeast Asia. Thank you.
Professor Ueda, please.
Thank you for your question. Could you explain that, you mentioned about the mobility and
morbidity, yeah.
Mobility.
Yeah.
Okay. Now I understand.
Sorry.
So because that my main that talk about the mortality, not mobility, and as you pointed out, that it's a little bit hard to obtain that the mobility the data in terms of that the conducting the epidemiological studies, because that involves the individual data set, especially so especially in Japan, it's relates to the the personal information, that for the some kind of the policy about the personal, how to handle that the personal information, and also that involves with the the based on my experience in Japan is that that usually the mobility data is just the collected in that within the hospital, just a single hospital, not systematically. So that's the problem, because air pollution, the health effects of air pollution is kind of the the effect is the slight, especially the it's not so big. That means that we need a really large sample size. So it's a little bit the difficult, but the currently there is some movement about the the for the combining maybe that it's a little bit difficult to do the similar studies, that collect the big data within the the in the region or globally, but the we can the conduct the the maybe the epidemiological studies within each areas or the countries, and then combine the results in the statistical methodology like meta-analysis. So I think that there are the more studies are conducted, and in terms of the the some the children, the I think that I know that the some cohort the which follows up the children, we call that birth cohort, from the human the baby, the getting had baby, and then they follow up for longer time life, the for throughout life, and then they that follow that health outcome. There are several the birth cohort ongoing, and then I believe that that kind of the results will be accumulated, so is this the answering the am I answering that your question?
Thank you very much. Yes, I my motivation to to ask that question is also the fact that there's a lot of interest also by UNEP, for example, that has been addressing the question of cost of inaction. I mean, there's a number of studies, not on UNEP, of course, but there is interest from the policy side, supported by international organizations as well, and that needs data. And in many countries, looking into Thailand or Vietnam or Cambodia, just giving few examples where some of the studies are now taking place, trying to understand better this cost of inaction needs, of course, data and solid data, and this is a difficulty. So I think it would be really good to put some more effort into utilizing the experience from countries where such information exists and help and support collection of data, harmonization of that. I don't know, maybe later on WHO would have some comments about it in Dorota when she speaks on that, but because I think this really needs an improved data set later on. I mean, in many countries. Thank you.
Thank you very much. I think that that as you pointed out, I think that the data availability depends on the country, especially the for OECD country have the maybe can access to such kind of data, especially health data. But in some countries, in the the low and middle income countries, data accessibility is quite limited. That's one of the issue, I think. Thank you.
Thank you. And now we would like to close this first session.